Welcome to another Vital Nursing video. In this video you will get to test your nursing critical thinking skills by answering one question. Can you get it correct? Before we start, subscribe for more videos like this to help you pass nursing school. We want to help nursing students succeed and become well-equipped nurses once they're in the field. Videos are uploaded frequently, covering multiple nursing topics. A client has been taking lithium 300 mg by mouth twice a day for the past 2 weeks. This morning her lithium level was 1. You, the nurse, should do what? Notify the physician immediately. Hold the morning lithium dose and continue to observe the client. Administer the morning lithium dose as scheduled. Obtain an order for benztropine. If we remember, lithium is a psychotherapeutic drug, specifically an antimanic drug. In order to answer this question correctly, you will need to be familiar with this drug and the correct dosage. Answer A is incorrect. There is no need to phone the physician because the lithium level is within therapeutic range. There are no indications of toxicity present. Answer B is incorrect. There is no reason to withhold the lithium because the blood level is within therapeutic range. Also, it is necessary to give the medication as scheduled to maintain adequate blood levels. Answer D is incorrect. Benztropine is an anti-Parkinsonism drug which is frequently given to counteract extrapyramidal symptoms. This then leaves you with the correct answer being C. The lab results indicate that the client's lithium level is within therapeutic range, so the medication should be given as ordered. So how did you do? Leave a comment below saying whether you got the answer right or wrong. Thank you for watching. Remember, we post videos weekly, so check in often.